Dr. Naveen, and he is one of the most loved doctors in our city of Bangalore.
Thank you. Keep away from us.
And here we are at the Bangalore Baptist Hospital, and Dr. Naveen is the director, and we're going to do a short interview to see what can we do during this COVID-19 season to keep ourselves away from the COVID-19. How far should I be during this COVID season?
Ideally, it is about 6 feet of distance between people that we should maintain.
Now, we have already crossed around 60 days of lockdown.
Right.
And there's a lot of information on social media.
Right. Too much actually.
Yes. And keeping that in mind, and that especially in Bangalore, it seems like very normal and shops have opened up. Do you think that can we just relax ourselves and get life going on?
One of the misconceptions that people have had is to say lockdown will kill the virus, which is not true. It has only slowed down the spread. Both the extremes are wrong. There was a person who came and told me that she just couldn't sleep because of this. That is a panic reaction, not advice. The other person who came to me said, I don't want to wear this mask at all. I don't believe that this is necessary. If you really count the number of times that we unknowingly touch our face, it is, mind-boggling. We should get out of that habit. Don't touch them in public. Not your mouth, not your nose, not your eyes. Avoid that. Let me tell you about cough and sneeze etiquette. We taught our children to cough like this. We have to re-educate them now. If you immediately have to sneeze or cough, if you have a long sleeve, this is the right thing to do. Cover your mouth with the hand. The other thing to do would be with your sleeve to cover your mouth and sneeze that way. You can use your tissue if you have, and you can reach it immediately. And again, make sure you cover your mouth and cough into it or sneeze into it. Remember, the tissue is now contaminated. It should be safely discarded, not just thrown around anywhere. Into the bin carefully, and wash your hands again. And your kerchief, if you have to use your kerchief, carefully, sneeze or cough into it. Remember, it is contaminated. Fold it, keep it back, wash your hands. Ideally, carry at least 2 kerchiefs. About washing hands, it is the lather and the foam of the soap which is important. Minimum of 20 seconds, 40 seconds would be ideal. Or both the surfaces of your hands, the fingertips and each finger, and the space in between the fingers. Remember that the entire surface has to be cleaned. 40 seconds is perfectly safe, and fortunate that soap kills the virus, in the sense it cannot replicate after that. This is something to take care. If you use sanitizers, again, the same way. Avoid crowding. Use a face mask. Friends, I will tell you about the different types of masks that you need to know. This is the regular cloth mask that you would have seen earlier. Very useful. It can be made at home and it's cheap. The good thing is it can be reused. It has to be fitted, onto your nose and cover your nose and mouth with this. And, it can be made of any color. It can be fashionable. When you come back, you just dip it into soapy water. That's enough. Or put it into the washing machine. When you want to take it off, don't touch the outside of it. If you're wearing it, just remove it from the inside and then put it into the bucket or into the washing machine. Cloth mask, double layered. They say it should be 65 GSM cloth, which should be used or above, and double layered, very useful. If all of us should be using it. And if you don't use it, you actually can infect the others. It prevents the droplet transmission. If others are not using it, please remind them to do so. Cover mouth and nose with this. Now, you would have seen the surgical mask. It is made of 3 layers of non-woven material. So it is to be used in healthcare settings, in hospitals. The problem with this is that this cannot be reused. May not be very comfortable in the long run because it's not a very absorbent mask. It has a nose clip, and you tie it or slip it on to make it snug, and again remove it from the inside. It is for use in the hospitals, in healthcare settings, or in places where you are likely to encounter fellow patients. This can be used, but it's only for one day, or if it gets wet, it has to be discarded. Cannot be re-sterilized. Now, you would have seen this. This is the N95 mask. So, this is a little cumbersome to wear. It is difficult to wear it in the long run. Ideally meant for single use, but now guidelines have come because of the shortage. It can be reused. UV sterilization, ultraviolet sterilization can be done. Plasma sterilization, in the sense hydrogen peroxide fumes can be used, and dry heat can be used, but the first two are preferred unless it is grossly contaminated. Now, this is for healthcare workers who work in emergency, in isolation facilities, in the ICU, ENT and dental doctors, nurses and paramedics, in such situations where it is very possible to encounter aerosols, but it is cumbersome, it is costly, it is in short supply. So these are the different types of masks, but in general, remember cloth mask. I think we must reconcile to the fact that we are here to live with this for a long time to come. Unless the vaccine comes, and it is at least a year away before it comes, if it comes, but we have to learn to live with this. So, it is a question of adjusting our lives around the reality. If you have a cold or a cough and fever, it is not right for you to go and mingle with others. Do make sure that you wear a mask and avoid contact with others till you get well. If you have been to a very large crowded gathering, or you have been in a hospital situation with a lot of other people, yes, it is better to take a shower. As soon as you go, wash your hands with soap and water, ideally for 40 seconds, and lather the soap. That itself will take care of it. And discard your mask into the washing machine if you have, or into the soap solution if it's a cloth mask. And change your clothes when you come from a very crowded place. Otherwise, the just washing of hands and changing of the mask should be enough. It is not social distancing, it is physical distancing. So that this is something to learn. At home, when we are together, in fact, there have been people who have come and said, I just can't tolerate it anymore. You are seeing the same faces again and again.
Yes. Yeah.
It is important to learn to recognize each other and to express, and to tell your children, tell your spouse, to go and say, I love you. It is something to vocalize, and that gives security and safety, knowing that relationships are there. Psalm 27 and verse 1, it's a beautiful verse, which I read 2 days ago, and it really encouraged me. The Lord is the light, He is the light and my salvation. Whom shall I fear? He is my strength. Of whom shall I be afraid? Not even the COVID virus.
Exactly.
We don't have to be afraid. That, it's a challenge. Of whom shall we be afraid? No one. Nothing. The Lord is with us. And we move on, but He expects us to use the common sense that we are gifted with. We must do that, and the rest is in the Lord's hands.